So we will start with the general concept of the survival analysis first, and then we will go towards the Kaplan-Meier, that is the specific type of a survival analytic tool, and then again we'll go to the this Cox proportional hazard. So the workshop objective is first we'll start with the basic concepts of what is this time to event outcome, because till now you have been reading regarding the event, whether that event happened or not, but this time we will add another component or another dimension into it, that is the time to event dimension. Then we'll see how we can construct the life table and survival plot. So you can construct the life table and survival plot using the actuarial approach. This I will just show you. We are not going to do a hands-on on it, or you can do hands-on also, but this we will just introduce the concept of life table, because life table we do not use very much most of the time in our data analysis, but the concepts are essential. That's why we'll tell you the concepts which are involved in the life table. And then we will show you how to construct a life table and a survival plot from a Kaplan-Meier approach. So you will see the difference, how this Kaplan-Meier is different from life table, and what specific information you get from Kaplan-Meier which you don't get into the life table. And then we'll see how to compare two or more than two survival curve using the various tests, because that testing of the significance level of survival curve is important. So these four objectives we will try to do it today. The other two, that is the compute and interpret a hazard ratio using a Cox proportional hazard, and to interpret Cox proportional hazard regression analysis, how to perform and how it is different from the linear regression or logistic regression, that we'll do tomorrow. So today is the day for a general concept of a survival analysis and the Kaplan-Meier estimation. So just see this bottle. What you can see here in this bottle. Before you read this question, anyone of you can unmute yourself and say. Ideally, this question should not have been there.
Actually, वो imagine पे ये मिल रहा है, space के लिए नहीं मिल रहा.
I think. Yes. May I request Darshana?
Yes, ma'am. Colorful butterflies.
Yes. Colorful butterflies in a bottle. Closed in a bottle. So if you want, because that is not very clear maybe from the picture. So the question is, if you want to know what is the average time a butterfly will survive in this bottle, if we keep this for 30 days and you plan to observe the bottle after 30 days. So can you get this answer? What is the, how many butterfly will survive in this bottle after 30 days? So please type in the chat box. So Dr. Poonam is saying yes, Tanya is saying no, Dr. Sunita is saying no, Pragya is saying no. None will survive, Vinita is saying. Okay. But you can, why can't you answer? You can come at 30 days and you can see who survived and who did not survive. Actually, this is an ideal condition. So yes, Emmanuel is writing that they will die in a closed bottle. Yes. So basically none will survive. The most appropriate answer will be the none will survive, because it's a closed bottle. But seeing the situation means if you open the cap of this bottle, then obviously everyone will be the lost to follow up in the context of a data. So in this case, if this is a control situation, so definitely if you observe this bottle after the end of 30 days, there is no loss to follow up and all the butterfly will die. So you can definitely get this answer that all the butterfly will die maybe after the end of 30 days, or you can reduce this period also, maybe 1 day, maybe few hours, depending on the the previous knowledge of how many days a butterfly can survive if no oxygen or no air is there. So that can be done. But you are, in this case, you are observing the death every day. Obviously, you plan to observe it at the end of 30 days, but you are seeing that bottle every day. So every day, you know that how many of them are dying or how many of them are remaining. So now in the next 4 slides, we will see 4 situations, and I want your remark over that. So just see this situation first. This is a pool of 50, I think 20. This is a pool of 20 males and 20 females. And you are following those 20 male and those 20 female for the occurrence of second attack after their first MI. So this is the time of the follow-up, and the follow-up time is totally 12 months. So out of this 20, you can see that 8 men developed a second attack of MI. And out of this 20 women, again, 8 women got this second attack of MI. So if we see the risk of these two situations, it will be total number of people who have developed this second attack of MI divided by total number who were at risk into 100. So it will be 40%. Similarly, for female also, we can say that totally 8 female developed a second attack of MI, whereas the total at risk was 20. So it was 40%. So can you say that the risk of second MI is same in male and female? Please answer yes, no, or don't know. Please type in the chat box. So Emmanuel is writing yes. Pragya is yes. Sunita, Nilima, all, Darshana, Tanya, Binita. So all are writing. Manisha, Anuja, Bala Kumar. So I think we missed the introduction of Dr. Bala Kumar and Dr. Lakshmi also. So we'll have maybe at the end of the session. So the risk is same in both these two scenarios. So now see this situation. Again, you followed 20 men and 20 women still 6 months after the total knee replacement to look for the full functionality, and 9 male out of 20 full functionality was gained, and 9 female out of 20 the full functionality was gained. So will you say that the risk of getting full functionality after total knee replacement is same in male and female? Can you say this? So yes, the answer to all of you will be yes, because the same number of male and female are turning into the full functional status, maybe after the period of 6 months. Now see the second situation. So in both these cases, what you are doing, you are seeing the outcome maybe at the end of 6 months in this case, and in the previous case at the end of 12 months. And you have not observed these people in between. But see this now. In this case, what can you see? What is, can anyone explain this picture? What is this? Any one of you? I may ask someone. Dr. Nilima, can you explain this? What is this picture? Whatever you are seeing, you can start speaking, and then while you are speaking, you will get to know.
Ma'am, we are following 20 males and females.
Yes,
they already
right.
had their first MI attack, and we are looking. We will be looked during the time period. We will look out for the second attack. So I am guessing that these red people suggest that they already had a second attack during the. These are events.
Okay, but can you see that why there are more number of people here, and if you see the women, there are more number of women here, and then you can see the time. Maybe if it is 12 months, so this is the initial of the 12 month, and this is the last part of the 12 month.
End of the 12 month.
So can you guess something from this? If nothing is written here, and just by picture, can you see something?
Ma'am, the time duration for second attack to occur is longer in females than males.
Yes, so, very right. So in this case, you can see that maybe the final risk is same in both men and women, or both male and female. But in the case of male or men, the recurrence happened in the earlier part of the time. Maybe this would be, if you divide it into the 3 section, this would be the first 4 months. Whereas in case of women, the recurrence, most of, like out of this 8 attack, the 5, this occurred during the later part. So final risk is still same in both male and female, but the additional information, what we are getting in this regarding when that event is happening or when that event is occurring. Is it in the initial part of the time period or the follow-up period or during the later part? So this information is necessary. So what about this picture? Nilima, you can continue since you have interpreted the previous one also. So I'll request you to interpret this also.
Ma'am, similarly, we can here say that the full functionality after TKR is achieved. It takes a longer time for males to achieve the full functionality after a TKR in comparison to females.
Yes, very right. So again, you can see here that in the initial part, only one, in the middle part, only one male, but in the later part, more men they recovered. But on the contrary, in case if you see these females, so they recovered earlier than the male. But if you see the overall period, obviously, like you have seen that the overall recovery, it will be the same in both male and female. So now, do you think this information is important for all of us?
Yes, ma'am.
Because then only you will realize the importance of survival analysis. Because the odds ratio or the relative risk, incident rate, or whatever regression logistic we do, we always see whether the event happened or not happened. That particular thing, risk is there or not there. But if you just see the time factor into it, then you can see how early or how late that event is occurring. That is very vital to us. Because the concept of survival, it has come from the cancer survival patients. So it has started with the survival of the cancer patients. So initially we used to have a concept of 5-year survival. But then we realized that, this 5-year survival is not appropriate because in many cases, the disease is so fatal that the patient might not survive up to 5 years. So that's why we resorted to this Kaplan-Meier, and we have left that concept of 5-year survival. But still historically, because that concept of survival was there, still we talk about that 5-year survival. But it has started with the concept of death. So ideally, if you see, all of us has to die one day. So that event is inevitable. It has to happen. But still we do the survival. And most of the time it was done very, on a large basis to the insurance sector. If you see the history, they used to calculate through life table, they used to calculate how long a person will live because they have to decide for the premium. In the case of health insurance also, if you see, they do actuarial analysis using these predictions and using these survival analysis. After how many time you will have a heart attack if you have got these risk factor. So that time factor, that is important, because with the risk estimation or with all those strength of association estimation, you can say whether that will happen or not. But after how long there will be recovery or there will be an event, for that you need this time to event data. So am I making sense to all of you why this time to event is important and how it is different from overall risk? So did you understand the difference between the overall risk and the risk at each point of time? So in this case, in the Kaplan-Meier or maybe in the life table, you calculate the risk for a time period. In life table, obviously you divide that. We will see it how we do that. But we calculate the risk for an entire time period in case of a life table, whereas in Kaplan-Meier, you calculate at each time period, whenever that event is happening. So that's why we call it as a instantaneous rate. That means whenever that event is happening, you are calculating that rate. That's why that concept of instantaneous rate has come up. So whenever you have this time factor associated with an event or outcome, that particular concept is known as the time to event data. And if you see these two examples, then you can very well appreciate what is the difference between an overall risk after a few years and what additional information you will get if you have this instantaneous rate of a particular event with you. So now, will you say that the male and female have the similar experience in both the situation? So definitely your answer will be no. So the speed of occurrence of an event is also important, and time should be taken into account while we analyze such data. So we have learned in the logistic regression and linear regression whether that event happened or not, because that is a binomial. In binomial logistic, we always, the dependent variable, we take that the outcome has occurred or outcome has not happened. And in survival, we take if it has happened or not, and if it has happened, when it has happened. So that when part is always there. So now this time to event data, like I have explained, if we are recording the time of the occurrence of event, then we can have the few cases recorded, but there will be a few cases which will not have that particular outcome, because we cannot have that follow-up period for the, we should have some cutoff where we'll stop the follow-up period. So in that case, we will learn about this, the concept which is known as the censoring, in the later part of the presentation. So in this case, what all you can see in this case? So I think you can see here that there is the first picture, what can you see? Anyone? Childbirth. Dr. Sunita is saying childbirth. Yes. In the second picture, so cure. Yes. And what is in the third? What is there in the third? So recovery. Yes. So there is a recovery, there is a childbirth, and there is a, you can say that hospital, that a particular accident is there. So the patient has recovered from that accident. Now, can you think of some disease and health related event which can happen, like for which you can have this survival function? What can be the event? Yes, hypertension, stroke, death in case of cancer, PPH, stroke, NCD. Very right. Cancer, metastasis, death, chemotherapy. Yes, but you have to define some, like Emmanuel is right, cancer, metastasis, death, whatever, some event you have to write. So in this case, by this question, I just want to emphasize that not necessarily this event will always be a negative event, because classically this concept of survival shows that it will be a negative event. Like classically it has been defined in case of a mortality, death, but it can be a positive event also. Like you can have that, after starting a particular therapy, after how long the person has stopped smoking. So that is a positive or a desirable behavior. Maybe after an intervention, you want to see, after a behavior change communication strategy, if you want to see whether that change in behavior of the person has happened or not. So yes, that recovery, or maybe after PPH, like Dr. Sunita is saying, after giving some treatment, whether the patient has recovered or not. After exercise therapy or a workout therapy, whether the patient has, or the person has lost weight or not, significant weight. So this classically, this survival, it always means whatever event you are describing, that event could be a positive or a desirable event, or the event could be a negative event like death, or maybe recurrence of tumor, or maybe the recurrence of myocardial infarction in this case. So it can be a positive as well as negative. But in both the cases, the term survival we use for the event, and we will see that survival is basically 1 minus probability of that event. So, and the hazard, we will see that if the event is happening, even if it is a positive event, we call that as a hazard. So don't go by this term of this survival. Survival term not always means survival. If it is a negative, then obviously this survival means as a positive one. But if it is a positive event, then this survival is like a negative thing. We will see it. So I think we will see in the probability how this survival and hazard are related to each other. So by this, the take home message is anything by survival, many of us confuse that is always related to death, but this is not true. Whatever event you are describing, 1 minus probability of that event is the survival, and that we'll see. So it takes time for an event to occur. So like if you have decided to recruit 200 or 300 patients, obviously you will not get those many patients in a day. So it takes some time to get that recruitment of the patient recruited. So in that case, there will be a start time and there will be an end time. So you have to define the event, the time to event data for which you are going to measure the start time and you are going to measure the end time. And that time could be in seconds, it could be in hours, it could be in days, or it could be in minutes, months, years, depending on your measurement value or depending on the whenever you are expecting that event to occur. Like in case of a anesthesia, like the patient recovers. So that recovery, you can measure it maybe in the minutes. Or if you measure by any intervention, if you are measuring the reduction in the pain level, then also you can measure that in minutes. So not necessarily the survival time is always measured in the years or maybe months. You can measure that in maybe minutes, maybe in seconds also. If that by intervention, like if a patient of head injury comes, or maybe a cardiac patient comes and you have given some intervention, so maybe he can be revived or some change can be there, some ECG reversal or some change can be there, then that can also be measured in seconds also. So that time, whatever unit of time you are taking, that has to be mentioned clearly how you are going to measure the time. So in any research, if you are recording the duration of occurrence of an event, like we apply the survival analysis. Some more examples will be like we have seen, the time to relapse after the occurrence of the first myocardial infarction. Or if you want to assess that after the application of an ointment, after how many, maybe hours or maybe after how many days the rash gets cleared up. Or if there is a person of coronary artery bypass, then after that surgery, till what time that person dies. So here the event is death. And again, you can measure the time of a fracture. After that fracture, how much time it takes the fracture to heal. So here the event will be the healing of the fracture. So usually it is not possible to enroll all the participants in a study at the same time. So it takes some time to happen. And in that case, we will see that there is an assumption in Kaplan-Meier regarding that secular trend. So Dr. Sunita, do you have any query? You have raised your hand.
In the previous slide, everything was written in the black background, except the second one. Why that yellow color for the second one? That's my doubt. Yeah, this one, an assessment.
Oh, this is I think just by sun. No, nothing. I don't want to emphasize. Maybe that I forgot to change the color. The last yellow.
Okay.
Ideally, it should have been just a error.
Thank you, ma'am. Thank you.
Okay. Thank you. So in this case, you can see that if a patient is admitted to, maybe this is a general ward, and you can have, now again, I'm emphasizing the time part, how you should record the time. So in this case, like if you convey the person or the head of the department, like this patient has come on, maybe I'm talking of this 2021, 10th of June, maybe 28th of July, 3rd of April, 16th of April. If you say like this, it is difficult to communicate. So how we communicate over the rounds, or that this is the 8th day of admission, maybe this is the 7th day, this is the Thursday, this is the first day. So what we do, for all the patients who are admitted, we have a common start point, and that is maybe their day of admission. So similarly, in survival also, you will recruit patient which may enter in your study at a different point of time, but you try to have the same reference point, and that's how the Kaplan-Meier does that. It takes every one the start point as a 0 start point, and then it calculates the time based on that common start point. So this is again a hypothetical situation. In this case, you can see there are 5 men, and you have followed up those men for the recurrence of the event. That again same which we have seen, recurrence of the MI, myocardial infarction, after the first event. In this case, you can see that this person has developed this event after 10 months. This person has developed after 2 months, 4 months, 8 months, and 6 months. So all cases are enrolled on 1st Feb. And then you can see in all these cases, the event has occurred. So you can see that at the end of 10th month, all the events has occurred. Means everyone has had the second attack of myocardial infarction. This is again the same situation. I mean that the event is the total knee replacement. So we followed these 5 individuals for a period of 12 months. And then you can see that after the first case has attained this at the end of 10 months, the second at the end of 2, 4, 8, and 6. In this case, as in the picture, you can see that start point is same. Since it is a small sample, so it can have a same start point. But likewise, I said that you may recruit individual over a period of 2 months, 3 months. So everyone will have a different start point in your case. But for reference, you take everyone as a single scale, and you have the start point at the same 0 scale. So in earlier situation, if you see this case, so now I'm introducing the concept of the survival time, how the mean and median survival time, which we see in the Kaplan-Meier, how to calculate that. So like we always calculate the mean. If you have to calculate the mean, how will you calculate the mean in this case? All of you, please calculate the mean of this hypothetical situation of 5 cases. I just want to ask the mean time of this happening of this second. So it will be 6, yes, 10 plus 2 plus 4 plus 8 plus 6. So it will be 6 months. Okay, yes, all of you are right. So this is again the 6 months, but this is the mean time of happening the event. Okay. But in real situation, how the study looks like. In real situation, you will never have all the people who are experiencing the event. In this case, you can see the blue ones. So the 3 of them, they experienced the event. But if you see these 2 people, so these 2, this was the loss to follow up. We don't know about this person. And in this case also, this person, he did not experience the event. Event has not occurred. So in both the cases, we don't know this. In this case, event is not happened. And in this case also, there is no event. So if you have to calculate the mean now, mean time of happening the event, then how will you calculate? Yes, all of you. So 10 plus 4 plus 6, 6.7, 20 by 3. So what you did, you have not taken these 2 people into account, right? That's how you did that. You did this 10 plus 4 plus 6 divided by 3. So in this case, if you calculate like this, you will not have the true picture into what is the median survival or what is the mean, because mean is not giving the true picture in this case. So now again, let's solve this with another question. So suppose the probability of dying is 10% every month for a disease. So we have fixed the probability here of 10% every month. You start with the 500 cases, and then you see that the end of first month, obviously 10% of 500 will be the 50. So you reduce the 50 from 500. So at the end of first month, 450 individual will survive. Then at the end of second month, obviously again 45 will go. This is just the 10%. So 10% of 450 will be 45. So remaining at the end of second month will be the 405. So 405 people survived at the end of the second month. In this case, at the end of third month, if you take the 10% of this, 364 will survive. And if you take this at the end of 4 months, 328 will survive. So I am taking this like a simple probability. I am calculating the probability at the end of every month by taking the previous number of remaining people. So do you understand this example? Do you understand? Because after this, I will introduce the concept of conditional probability. So this is the simple probability, means we are just calculating a fixed probability with the 10%, how many of them remained at the end of a fixed period. Here the period we have fixed after every month. We are not calculating in between. So there is a period, and we are saying that the probability of dying is 10% after every month. Okay, so this is the simple probability. This is not the conditional probability, because in case of a Kaplan-Meier, there is a concept of conditional probability, and how that probability is different from this simple probability. I just want to emphasize that concept. So this have you understood this simple probability? This is again the same problem, but we have started with the one number, 1%. So because probability always ranges from 0 to 1. So that's why maybe I am starting with the 1%. So we start with first 1%, then at the end of first month, it is the 0.9. Then at the end of maybe second month, it is the 0.81. And then at the end of third month, it is the 0.73. Similarly, it is the same concept which you have seen in the previous example. So at the end of every month, we are calculating the probability of survival of that person. So in the previous hypothetical example, you have fixed the probability of people dying from or not dying or any event. I should refrain myself from dying, because then that will give you a wrong meaning. So whatever event you have defined, that probability of happening that event is fixed here. But in real situation, this is a random process. It is not fixed. So that's why we calculate the instantaneous rate. It is not the periodic rate like we take in the life table, where we fix the rate for the entire duration of 1 year. So it varies, this probability of event, it varies at individual at each point of time. So similarly, the survival. So I have said that 1 minus the probability of event will be the survival. That is the no event. So the survival analysis, you follow up a particular happening of the event up till the time t. And since this is a dynamic, because this t is a dynamic, and that's why we study this in the terms of probability. So this event, like you have again said, that it could be relapse, it could be failure, it could be the disease, etc. So a survival analysis is a statistical method for studying the occurrence and timing of the events. And this survival time refers to a variable which we measure from the start time till a particular end time. And we know this, that you should define whether you are going to measure this time in seconds, in minutes, or maybe in hours, months, days, weeks, years, whatever. And the time to follow up for each subject, it is a unique variable, and this is the dependent variable in this case. So in SPSS, we will see that this time to follow up, this is a time to event data, which is a scale variable. If you can recall your sessions on variables, the type of variable, you know that there is a continuous variable and there is a categorical variable. In continuous variable is also known as the scale variable in SPSS. So this time to event is a scale variable which we measure, and that is the dependent variable in this case. In logistic, because we will compare this Cox proportional with the logistic regression, and there are a lot of similarity between these two. So there you can see in logistic, the dependent variable was a binomial. It was a category with a categorical variable with two category. But if you see this survival analysis, this Kaplan-Meier or this Cox proportional, then this time to follow up, this is a scale variable and this is the dependent variable. So the survival studies, generally this analysis we usually do in case of a randomized control trial, or we can do it in the form in a cohort also. So like it is usually most commonly done in the clinical trials, just to see the happening, because in clinical trials also you have a time to event data and you see when that event is occurring, because there is a fixed, you follow up that period at a fixed interval of time and you have a particular event happening or not happening, and then you have the censoring of the data also, which we'll see how that censoring, or what is this concept of censoring. So this we use this for a prospective cohort study also, or you can have this analysis in the retrospective cohort also. But we know that the typical survival data that are not fully observed, that means there will always be many people who will be censored. They are not fully observed. Now you can hear a different word here, that is the censored, that is the censoring. So now we will see what is this censoring. So till now what you have understood, that there is a time to event data, how this time to event data is different from the last outcome, and what is this simple probability, how can we calculate the probability of an event happening at the end of a fixed interval. And now we are going to understand, or we are going to know about the censoring of the data. So this again, this is again the repetition, because this is a time to event data, and time, you know that it is not fixed. So it is always skewed in nature. Most time to event data, because the happening of an event is not fixed and it is very much variable. Like you have seen previously also, one person is experiencing the event at the end of 1 month and maybe the other person is not experiencing even at the end of 12 months. So that is quite variable, and that's why it doesn't follow the normal distribution, and that's why it is skewed in nature. Hence it is, that's why we cannot have that usual calculation of median, I mean mean, and the other parameters of normality, because we cannot have that normal distribution of the data. And that's why this Kaplan-Meier, this is non-parametric in nature. And this event, again, this event could not have happened yet, and that is the censoring. So the some common terms are survival time versus survival data. Now, what is survival time? So if you are measuring the happening of that event has occurred. So 1 minus that particular happening is the survival time. So for each terminating event, you can record that amount of time, and for one person or one patient, this time is referred to as a patient survival time. What is survival data? So the set of survival times which you record in a study is known as the survival data. So now second is the censored time and censored data. So for those individuals where they were lost to follow up, you don't have that outcome with you. In that case, that is the censored time. So censored time is the survival time of loss to follow up of cases and event where you could not measure that event. or that event has not happened. So that is known as the censored time. And all those data set of censored time is known as the censored data. So there are basically, we have three requirements in a survival analysis. We define the event of interest, we define a start point and end point of a study, and then we select a time scale. So suppose you want to see the progress of a patient until the occurrence of some well-defined event, and in this case, like occurrence of a second MI after first MI. So in the first case, you can see that the event occurred. The person had second MI. Yes, Lakshmi, from now, I think for 4 or 5 slides, I'll keep on talking about the censored data. There are a lot of information which I need you to give regarding the censoring. Please wait for a few minutes, and then again, I'll repeat the concept of censoring of data. So in the first case, can you see that the event has occurred? In this case, there is a recurrence of MI in first case. Okay, so in this case, the event is occurring. In the second case, the event, I don't know about the event. The person has said that he doesn't want to be a part of my study, so he is lost to follow up. Maybe he has migrated to some other area, or he has stopped coming to me. So I don't know about that person. So that was the loss to follow up. And then there is a third person where I have followed him up till my study period. So if my study period is 1 year, I have followed that person till 1 year, but still that event has not happened. So in this case, you can see there are 2 cases are censored. Out of 3 cases, in only 1 case the event has happened. In 1 case, the event has not happened till the end of the study period. And in this case also, this case was a loss to follow up. So these 2 are example of censoring, which is the right censoring. So now what is a censoring? Censoring is the observation which you could not do fully on that individual. Or even if you have done the full observation, that person has not developed that event. So that we understand by censoring. Means the absence of event is censoring. In case of a survival, you can have only 2 possibilities, and that we will see in the assumption also. Either the person will have the event. In this case, it is the second occurrence of MI. Or if you define the term as death or event as death, then either the death will happen up till that particular time. In this case, time is very important, because you, in your study, you cannot keep following a person till 50 years or 60 years. So you have a limitation of a study duration. So in your study, till you have, like you keep your follow-up period for 10 years, either the person did not die at the end of 10 years, or the person has moved out of your study and you don't know about him. So in both the cases, the event has not happened, and that's why it is known as the censoring of the data. And in this case, it is known as the right censoring. So the censoring is of 2 types. So what is censoring? So censoring is a statistical term which we use to describe the process of producing the incomplete observation. Because if the event has not happened, or we don't have the record of the event, we call that data as a censored data or censoring, and that observation is known as the censored observation. And you know about what is censored data and what is censored observation. So now how censoring can happen? So either you don't know the exact survival time, or there could be loss to follow up, or the event has not occurred till the end of the study. In all these 3 situations, there can be censoring. Is it clear to all of you up till this point? Anyone who have not understood up till this point, or any concepts would you like me to repeat? Then I will come for the concept of this right and left censoring. And there is another concept of informative and non-informative censoring. But before that, okay. So Lakshmi, is it clear now? So you said yes. So I'm assuming that you have understood. So opposite of event is censoring. And there could be various reasons of censoring. Like I have explained, either the person has moved out of your study, you don't know about him, or the event has not occurred till the end of the study period, or these two are the example of right censoring. Now, what is the left censoring? So censoring is of two types, right censoring and left censoring. A right censoring, whenever the exact time of occurrence is not known, either because the subject is a loss to follow or the event has not happened till the end of the study. So you can see here, if these two are the happening of the event, in this case, you have followed this person up till the end of the study, but the event has not happened. So this is again the right censoring. In this case, this person is a loss to follow. So this is a right censoring. So you have got two things in your hand, a start time and an end time. So if you don't have an end time, it is known as the right censoring. So this is the right censoring because it is towards the right side of this line. Now the another concept is the left censoring. So this left censoring is whenever you don't know when the event has happened. So the exact time of occurrence of event is not known, then it is known as the left censoring. Now in this case, you can see here that the happening is that if there is a recurrence of tumor, so maybe you have done the surgery of a breast cancer surgery and the person has come to you with the recurrence of the tumor. But since in the diagnosis, if the tumor is not symptomatic or that you don't know what is the exact time of the happening of that event. So if there is a problem with the start time, then it is known as the left censoring. If there is a problem or there is some ambiguity regarding the end time, then that is the right censoring. So start time is for the left censoring because this is towards the left side. You have to start it. So if you don't know exactly when that event has happened, exact time of happening of that event is not known. So whatever you observe, so actually after that surgery, that person has reported to you at 3 months, but maybe the event has happened somewhere in between. So this observed time will be always more than this. So this time will be less. Actual time will be less than the observed time. So this is the left censoring. Any example of left censoring? In many cases, like the left censoring is not possible. You can, there is no possibility of left censoring. Can you write few event where there is no probability of left censoring? Cancer. No, cancer, yes, there can be left censoring post-op infection. Post-op infection also, how will you come to know? There may be some latent infection, subclinical. Yes, death. There cannot be a lag period in detection of death. So death can never have a left censoring because the exact timing of death will be known. Are you getting the concept of left censoring? Okay, so I need to repeat it. So left censoring happens whenever you have got, you are not very, yes, birth. Dr. Sunita is saying birth. Birth is also, there is no possibility of left censoring. Okay, so if you are defining that after birth, after marriage, after how many years of marriage there is a birth. So event is a birth here. So there is no possibility of a left censoring. So birth, death, these are very clear-cut events. There are many more events and that we will look up. We will have more discussion. But just to explain once more regarding this left censoring. So left censoring, we classify whenever that exact timing of event is, we don't know when that event has happened. So the person is there with you, Yes, birth, marriage, divorce. Yes, right. Maybe the copper T removal. There is one more example. If you have defined the occurrence of an event that after inserting the copper T, after how many weeks or month, the lady has got it removed. So is there any possibility of left censoring in this case? Because you will come to know, you can have exact timing, you can maybe on the basis of history you can ask, and if that lady comes to you only, she's not going to any other practitioner, then definitely there is no possibility of left censoring. But if there are other practitioners and she is going to some other person, then there may be a possibility of left censoring, because exact timing when she got it removed, if it is not documented, then there may be some ambiguity. But that's why survival in those countries where the all these data, it is if it is linked to the real time capturing of data, then you can perform a survival analysis very easily, because you know exactly when the event is occurring, and there is no possibility of left censoring. Because in your data analysis of survival, we will read about this, that you should try that there should not be you should try to minimize this left censoring. Okay. So left censoring is, Pragya, whenever the exact timing of happening of event is not known. Like if you want to recruit the patient of a skin cancer, so you don't know exactly whatever person is coming to you, but there may be a case where the if your event is skin cancer, means you have given some radiation therapy. Maybe if you do a study on radiologist, you have got a few radiologists in the radiotherapy department, and you want to see the development of cancer maybe in those people. So your event is the development of cancer in those radiographer or the person who is actually doing the radiotherapy, and you don't know exactly, maybe because it has got a latent time. So that detection of the cancer, it may take some time, and it may be the technique which is available with us, if it is not that sensitive, even if it is sensitive enough, it will not pick up the occurrence of cancer at the moment whenever it is happening. So yes, that would be a left censoring, because the exact timing of the occurrence of an event is not known. So like blood pressure control, left censoring. Yes, because exactly you don't know when that person has got the control. So there will be a possibility of left censoring. So if copper T, yes, goes off itself, individual realizes only on getting pregnant. So yes, then it can be left censoring, because you don't know when it got removed. Yes, this is a good example of left censoring. So the Nilima is asking, if the start time is not known, but exact time of event is known, will it be considered a censoring? See, start time start time is always, if you define some event. So what is start time? Start time is the recruitment of that patient. So if you are planning to recruit, because you know that you always do this in some form of maybe randomized control trial, you have seen that the survival analysis is done most commonly either in the randomized control trial or in the form of a cohort study. So if you recall that study design, in cohort, how we start? We divide in the exposure and not exposed, and then we follow up for the development of a disease. Or in randomized control trial, you have a two group, you have got intervention and a control arm, and maybe you want to see the effect of one intervention over the other. So in that case, you recruit the patient on the basis of the eligibility criteria. So the start time is always known, but the happening of that event has occurred, but maybe the definition of that case is such that, or the event you have defined. So that's why in survival analysis, that event which you are describing, that should be measured very accurately. So that's why if the time when the event is happening, it is not possible to do it every day, every second. Since, see, the occurrence of maybe if you have done a surgery on a particular individual, maybe hernia, and if you want to see the recurrence of that hernia, so it is not possible for a doctor, because that patient might miss. If it is an early stage, that patient might miss. He will not come to you in the early stage. When the hernia has recurred up to that level that it is causing symptom, then only that person will come to you. And it is not possible for you to follow him up every second in the real time. In that case, exact happening of that recurrence of hernia, you will not be able to tell. So by this, what I want to emphasize that you should try to do the survival analysis of only those events where you can clear cut define, and there should be a minimal lag period between happening of that event and reporting it to the health facility. So onset of depression, yes, it is a left sensor data. So that's why if you are measuring, so this is not fit. This happening or the occurrence of depression is not a good event to do a survival analysis. Why? Because this is latent. Even the person doesn't know when, if he's suffering from depression or not. So if the happening of that event is not very objective, or if it is not linked to a data system where you have the exact real time, then it is difficult for you. Then for those data, you should not be doing the survival, because there will be a lot of possibility of a left censoring, and the observed survival which you are going to measure, that will never be a accurate observed survival. Yes, RTA, very right. RTA will be there will be no left censoring in RTA, because RTA will be registered. You can cross check it, and obviously after RTA, a person is going to come to you. Yes, that can be event, because after getting that license, after how many days that person has, because you have to define also the start time. So yes, in case of a RT also, there won't be a, or if you have RT, how, because if you have given, there are two groups. In one group, you have done a behavior change communication regarding the use of personal protective, like use of seat belt and use of helmet. And then you are measuring the outcome as a road traffic accident and injury. In that case, definitely there is no possibility of a left censoring. How the right censoring can happen in case of a RTA? Anyone? How the right censoring can happen in RTA? There is no possibility of, yes, Tanya, you are right. But how the this right censoring can happen? Can't be followed, okay? Another situation? That because you will be, okay, death, okay, that can be one, this thing, because RTA, disability, that is the event. Yes, no event, RTA has not occurred. You have kept the study period up till 10 years. And till 10 years, if there is no RTA, then that will be a right censoring. Because that up till your period of observation, if that particular event is not occurring, that is RTA. I mean, that is a right censoring. So now, do you understand the left censoring and right censoring? Is it clear to all of you? Anyone who wants? Yes?
Ma'am, left censoring doesn't occur in the study period.
Left censoring is occurring in the study period, because you recruit and then you define the event. So you have recruited an individual in your study period and you want to, so that event has happened. But that till the time you know, the event has happened before that. So what you observe will be always more than the actual.
Okay, ma'am.
Did you get this? Dr. Binita, you have also raised your hand. Dr. Binita, do you want anything to be cleared? I think
hello, ma'am.
Hi, Binita.
Hello, ma'am. Ma'am, you said in case of death, there is no left censoring. But if somebody dies at midnight and the family members, they discover them in the morning that the person is dead, why in this case can't we get left censoring?
Yes, if like in case of a forensic, it depends in what department. But again, if it is a forensic study, then they can decide about the time regarding death. Or in case of a SIDS also, you know that time will be there. But in that case, you will keep your measurement not in hours. You will keep the
Okay.
measurement scale in days. You are
Okay.
right. But
Okay, yes.
in that
Yes,
case,
ma'am.
the unit of measurement will be day. So you will have that maybe on 10th of day, and that is registered also. You need a death certificate, right? So
Okay,
you
ma'am,
go-
got it, ma'am. Thank you.
Okay. So again, that unit in which you are measuring that event, that should be realistic. So we are not going to measure that maybe in hours or seconds, and we are going to measure in maybe days, okay, or maybe in years. So anyone else who would like this left censoring or right censoring to be repeated? So again, to reiterate, left censoring is whatever event you have defined, if the exact happening of that event is not very clear cut, and there is some lag, latent period before happening of that event, and diagnosing it either through the health system or through the data or through the patient itself, because there are many times when the patient reports or they make a diary of all those events. So if something of this thing happened, then those data are not a very ideal data for survival analysis. So that's why you will see, we will share many papers also. I think we have shared it also, and you will see that how they define event. So this censoring will help you in understanding, because usually this survival analysis is performed as a part of analysis of a RCT or as a cohort. So or we can do it on the already whatever data is there. Like we were planning to do it in our health center whenever there is a record of this copper T insertion and removal is there. So you will take only those cases who are registered with you. So then you know the exact timing. Or you can plan to have a survival analysis on the Nikshay portal, the tuberculosis, whenever you know that patient has come to you, or he has not turned it up, so you can do the survival analysis of such type of data. Generally, we don't plan a survival analysis newly. You usually do it on already existing data, and that is a part of maybe an ongoing cohort or a completed cohort, or in a RCT. That is the most two common type of. But in case of anesthesia, definitely it is the very appropriate department to do the survival analysis, because whatever outcome they define, that is not very long. And maybe in ICU also, the anesthetist who is working in ICU, you do a trials or you do observational study where you follow up, you give some intervention, and then you see whether that person is recovering or not, or when the person is that death is there or not. So in case of anesthesia, but in case of a community medicine, when the things are taking very long to develop, it is difficult to plan. But in other scenario where that happening of that event is not very long, then you can plan a survival analysis, or it can be a part of your randomized control trial, or a retrospective or a prospective cohort. So any confusion up till this point? Okay, if not, then should I move forward? Okay. So now with this, this was about the general concept of the survival.